Hello, everyone, and welcome to this audio podcast. This audio podcast as part of the series The Storm Solar. This audio podcast as part of the series a chartered edition and an evidence-based edition. This audio podcast as part of a stellular impeach, and this audio podcast as part of a series in around the rupture feature and a storm robotics and this audio podcast is part of a Storm Robotics production. Now, in this audio podcast, looking at the sort of some of the sort of some of the sort of discussion and conclusion aspects are in around this peer reviewed and sort of anticipated published works from 2024. This sort of clinical correlation publication looking at understanding education for healthcare service users aligned to social media platforms, and where this works sort of delves into highlighting some descriptive data between pediatric and adult nephrology social media platforms. So in around the sort of discussion aspects, the RPSG or the Renal Patient Support Group earliest threads or discussion and topics date back to 2009, which focused on renal replacement therapy or kidney replacement therapy, laboratory parameters and biomarkers, medication and pharmacy, primary care, uh, electronic patient records, peer support, nursing and wellness. KDAR's earliest threads of discussions. So the sort of the pediatrics or young people sort of equivalent of the renal patient support group RPSG social media platform were similar. Uh, topics tagged sort of date back to 2014 and include renal replacement therapy, laboratory parameters, medication and pharmacy, nutrition, surgery, lifestyle, physical activity, electronic patient records, nursing care and wellness. The highest This highlights, or this work highlights or informs that online and healthcare educational information is still lacking for healthcare service users. Amongst the varying themes identified, service users often sought to identify advice surrounding advice surrounding chronic kidney disease, and peer-to-peer interactions through social media platforms also prompted patient empowerment, but alone peer support is inadequate. Often patients are not always aware of disease severity, and so access to allied health professionals or AHPs through an online space may support patients linked to chronic kidney disease healthcare or CKD healthcare. Having access to a network of AHPs could also encourage CKD patients to feel more included or inclusive, thus increasing practical understanding of illness or disease treatments and overcoming educational hindrances or barriers. So, in around the sort of conclusion of this works, then for 23 years, healthcare service users, between the RPSG and KDAR social media platforms have been utilizing experiences to help inform and inform care and decision making. Patients utilize the social media platforms as space to gain perspective and understanding of different kidney care topics, and they may otherwise where they may otherwise have limited peer support and healthcare involvement. One question here at the same time is should healthcare service providers only support if context is clinically relevant? Clinically relevant. Now, in line to this particular question, there is works there is works that have been published by authors in around 2017 that inform in their works that through online spaces through online spaces, albeit whether through social media platforms, whether online forums, online blogs, through online organizations, etc., where healthcare service users sought to identify applicable healthcare service information. The authors inform that in their work that most of the experiences or discussions that are had through online for healthcare service users tend to be non-clinically relevant, owing to where the authors inform that the terminologies that healthcare service users utilize, for example, inform that they because of the terminologies that healthcare service users are not directly linked to that terminology that electronic patient records are coded with a link that are linked to coded information, coded literacy, let's say, or coded literacy, let's say, thus to thus makes the the shared or lived experiences that healthcare service users utilize or implement through online spaces or social media, etc., less clinically, owing to their not being clinically relevant, also means can also mean that the lived experiences are also of are less clinically relevant or of importance. And so in following this important question, again, this important question, should healthcare service providers only support if the context is clinically relevant? And so because patients are not trained to communicate clinically relevant context, it could be debated that the majority of experiences experienced through social media platforms is all important and relevant. Healthcare service users have own ways of interpreting and communicating healthcare complexities. And so, although the two social media platforms primarily or have been working through Facebook, co-developed e-modules could help integrate healthcare between patients and healthcare professionals, based on themes as identified and help steer clear of misinformation. This is the first international retrospective study, a study that examines educational themes between online pediatric and adult renal cohorts in over 2 decades. That draws this audio podcast to a close. This audio podcast, as part of a chartered edition, this audio podcast as part of an evidence-based edition, this audio podcast as part of the series The Storm Solar, this audio podcast as part of the series The Stellular Impeach, this audio podcast as part of as part of the Rupture feature, and this audio podcast as part of a Ztorm Robotics production.